Thank you, Keith. Good afternoon. I'm Sheila Hamilton. I'm the host of the Kink Morning Show, and I'm also the author of All the Things We Never Knew, Chasing the Chaos of Mental Illness. It's the story of my husband's descent into mental illness and the experience that we had dealing with a very fractured and often traumatizing mental health care system. The antidote for me has been the incredible partnership that we've forged with Trillium Family Services. They're the largest provider of mental health care services for children and families in the Northwest, and incredibly innovative. And I'm also the author of All the Things about how we might all work more collaboratively. This is why we're here today, and I'm thrilled to be part of the discussion and also to join those of you who are watching on the stream today. We're using the hashtag today of social impact. Social Impact 2016. So please tweet, and you can Facebook questions, and please be a part of the conversation. I'd like now to introduce Wendy Ellis. She's the National Project Director for Building Community Resilience.
Well, thank you, Sheila. It's wonderful to be back here in the Pacific Northwest, where a lot of this work that I'm doing nationally had its roots up just a little bit I-5 in Seattle. What we're doing is called Building a Community Resilience, and what I want to talk about before we show you the short film on the work that we're doing across the country, and particularly here in Portland, is building resilience. But let's talk about resilience first, what we're talking about. Resilience can be defined at 3 different levels. When we talk about individual resilience, personality characteristics and traits, at the family level, how the resilience of a family, and at the community level. And the reason why our work is really focused on the community level is because we understand what influences a person's individual traits, a family's ability to not just bounce back, but bounce forward, really depends upon the resources and the availability of individuals within that community. So this is about stitching together those important systems, going across sectors to build community resilience. Watch the movie.
Across this country, child health systems and their community partners are joining together to address adverse childhood experiences, or ACEs, in the context of adverse community environments. The Building Community Resilience Collaborative is aimed at addressing this American public health crisis by joining healthcare, public health, community systems, and parents in a multifaceted approach to build more resilient communities. 22% of all American children have at least 2 or more ACEs. These include physical, emotional, or sexual abuse. Some have witnessed violence, either in their own home or community. And this is in line with data indicating nearly 10 million children live in violent neighborhoods. Compounding effects of community violence, nearly 45% of our nation's children live 200% below the federal poverty line. These statistics indicate that households that should be focused on providing nurturing environments for children are instead grappling with the crippling effects of poverty, often living in poor housing conditions, struggling to put food on the table, while balancing fears for their emotional and physical safety in a neighborhood that is besieged with violence and crime. In order to build resilience, sectors must come together to provide buffers for many of these stressors that are daily occurrences for far too many children, families, and their communities.
So I think for a community to really be able to be resilient, they have to have a common understanding, a common, share a knowledge base, share a language, share values, and then share how they're going to be together, what they're going to actually do that makes sense.
The Building Community Resilience approach provides healthcare partners a framework to develop a shared understanding of the adversities associated with poverty that have an impact on health and well-being. Through a strategic assessment process, they're able to assess their own capacity to respond to upstream social determinants, build a coalition of cross-sector partners, and engage parents, families, and community stakeholders in the resilience movement.
We focus on quality education programs, food, nutrition, and family support. And we really think that through providing those things, we can help to build stronger children, stronger families, and stronger communities, and we don't want to do it in a bubble. And so it's really important to continue to partner with organizations who are doing similar work.
This upstream approach comes at a pivotal time in our nation's thinking about how to deliver healthcare, public health, and other community-based services. BCR provides a model that fosters collaboration across sectors to address both health and social determinant needs, some of which are associated with poverty, some of which are ingrained in our systems, such as institutional racism, inequities in community investment, and inequitable distribution of resources that negatively impact health and well-being.
There are a lot of structural barriers that exist from the standpoint of how communities are built, the physical resources and the economic resources that are so limited in many communities. There's also the way that public services are organized and things are siloed into health focus or education focus or mental health focus or housing focus. And, you know, we're sort of convinced, as are many others, that those things are intimately interrelated, and yet strategies to change any one of them sort of has to stay in its lane, according to the old way of doing things.
Change is slow, and everyone's working harder for less, and everyone's busier than ever. So this work, in order to succeed, has to be integrated into current workflows. Workflows need to be modified and changed so that we're able to incorporate our knowledge of adversity and the effects of adversity into the care we deliver.
Through the generous support of the Kresge and the Doris Duke Charitable Foundations, we have brought together 5 of the country's leading health systems to build a bridge to the community, a pathway by which community organizations and cross-sector partners can help address adverse childhood experiences in the context of family and community. We're developing a shared understanding and sharing our learning across teams.
The BCR Collaborative is about going deeper versus just wider.
As part of the Building Community Resilience movement, we are building bridges to community, a journey that requires building coalitions based on trust.
Without trust, nothing good happens between human beings. So we have a lot of trust rebuilding to do. There are things that have happened that are really, really traumatic and bad and make people's lives so terrible. So the rate of poverty that we have, the long-standing history of racism that we're dealing with across the country, right? That trust has been so eroded in just an understanding of who you are in reference to who I am. What can I expect out of my social group? What can I expect from other people? So what I think the way it's talked about is the erosion of social capital.
By connecting systems to grassroots efforts, underway in communities, as well as fostering the growth of those community-initiated efforts that will improve health and well-being, health systems can truly be partners in not just the delivery of healthcare, but the fostering of a culture of health.
What really needs to happen is like a revolution. It really is like a political and economic revolution in the way that we structure, health and social services in our country.
Building community resilience is about providing a framework for this revolution in healthcare and public health by connecting systems and communities at the grassroots level.
And I think that that's what's happening in our community is that we're convening and building an arena for people to talk about kind of this universality of trauma rather than there's something wrong with you as an individual. In some ways, we've all experienced traumas to one degree or another.
This co-collaboration and co-creation of solutions, and it really helps us think about what families do well. So as Angela Blanchard would say, you don't build on broken, you build on what people already do.
The path forward, although uncharted, provides promise. And with BCR, we are creating a roadmap for others to follow. We recognize that resilience will come from healing. Healing comes with trust, a trust that is built over time.
And this is the toughest thing for us to do because,
trust. At the end of the day, we're trying to develop trust
And
relationships that we have not been really good at doing. And so to be able to put ourselves in that vulnerable place, to know that we don't know who we're really talking to, but we have to keep trying. We can't stop. That's going to be, I think that's one of the biggest challenges for us in working with community.
So enter with humility.
Humility. What do we say in our PCR meeting? Take off the white coat and be a citizen.
We want to share our lessons learned, our tools, and our resources. Currently in development is a communications platform to help coalitions and systems tell the story of ACEs to key stakeholders. We're also developing measures and data reporting to measure the impact of cross-sector collaborations in public health. Come join our community as we help to build community resilience across the nation.
So that's just a primer on building community resilience. And I want to give you an opportunity to understand what organizations like yours are doing in some of those communities that we highlighted that are a part of our movement. The social impact organizations, which we're changing the vernacular here, moving from nonprofit to social impact, because that's truly the work that you're doing. You're impacting the communities and filling important gaps that our public systems are not able to do for a variety of reasons. And what you are doing is helping to address some of those adversities that are occurring on the ground every day, the everyday social disasters that are occurring in our communities. Here in Portland, I've just been back for a couple of days, and I've witnessed just the exponential, it feels like exponential growth in homelessness. And the face of homelessness has changed. We are talking about entire families, children growing up with multiple traumas from living in poverty and all of the associated stresses and burdens with that. And so today what we want to talk to you about is, what is your role? What is our role collectively as working with part of the private as well as the public system and helping to really knit together this system of care? A system of care that right now does not exist, and the system of care as is defined is broken. There are too many holes, too many critical fractures in this system that is not serving any of us. And without the work that you all have been doing for a number of years, even more hurt would have occurred in the community. So I want to bring up my colleague Sarah, who in April we had an opportunity to really come together. There's a number of us here that are from the Portland area, and we're scattered across the country. I'm based in Washington, D.C. with the BCR team, but Sarah is based in New York, and we had an opportunity, a unique opportunity, to get together in April of this year and put our minds together and think about how would we using BCR as an organizing platform, really bring together what are our disparate, what seems like disparate efforts, right? in a way that could be most impactful. So you have this graphic, and I'll move over to the other side and let you kind of walk through what we put together.
So we're really privileged, all of us, to be part of a team that was convened under the leadership of Trillium. And the vision that Trillium had for creating transformative innovation, really helping us to commit to being willing to take risks for the purpose of impacting real social change, pushing us to be part of just the beginning of a conversation which we knew and hoped we would be inviting all of you to join. The folks at Trillium took some time to think about what elements might be important to have in the conversation. So there were some particular tenets that were identified that really led to our being invited to participate. But there are some things that we all had in common that I think are important to highlight. The first is that we are all individual activists, but we also have connections to larger organizations, social movements that provide access and also a level of expertise that I think was helpful in getting the conversation started. The second thing that we had in common is that all of our work, although very different, really convenes at the juncture of social determinants for health. We all are both impacted by families and children and individuals, communities who struggle with those social determinants of health. And also, our work is really built around intervening to improve the social determinants of health. But coming from very different viewpoints and very different angles. So Trillium's, I would say, genius was in bringing together, as a starting point, this group of us to think about what we might do differently. And behind us, you'll see our beautiful creation, which we'll describe shortly. But first, I want to talk with you about what those tenets were, and each of us will describe the role that we had in this process. So I'm going to ask our team to come up, if you wouldn't mind, and grab a mic and a chair. And we're going to, I'm going to ask you to introduce yourselves, say what your organization is, and how your role is connected to one of these tenets. So the first, John, don't get too comfortable, is the first element or tenet was about mobilizing community. And that was really the area that John represented in the conversation.
Hi, everyone. My name is John Donovan. I'm Senior Vice President of a firm called Metropolitan Group, and we're a social change agency that works with socially progressive and socially motivated organizations from all different sectors across the country and across the world who are committed to making a just and sustainable world. We're excited to be a part of this, and we were thrilled to be invited to be a part of the initial kind of beginning conversations that we are excited to share with you. Because we come from a belief and a worldview that suggests that everyone has so much to offer, but it has to be offered from a space of respect, and as you heard on the video, of trust. And for us, that really boils down to understanding the shared values that we bring all of us into conversations together about how to address these needs that are so apparent and so crucial in every part of our world that we experience. And so for Metropolitan Group, we're thrilled to be able to bring some of the experience that we've had in building movements, in working with a lot of different communities in these various sectors that are now really more than ever recognizing the intersections and the cross-pollination that can and should be happening. And our role as a communication and creative agency is really to help facilitate and to bring our own experiences to the table, but to work, frankly, in community and with the community members that are a part of these very important needs and experiences, so that it's not done to community, as a very good friend of mine will help me make sure we get across, but is done in a space that allows the community to be, frankly, very much not only part of it, but frankly to help really have ownership and driving towards the solutions we can all create. So that's a fundamental sort of a summary of the way we approach our work on building the community and creating community movement, and we're excited to be a part of this. Thank you, Sarah.
Thank you. We also understood that work around anti-racism and anti-oppression were going to be really important and powerful elements as well. And Michael's voice was one that was at our table to represent those perspectives.
So I'm Mike Ware with the People's Institute, and I'm an organizer, and we primarily focus on organizing communities. And so just to give you an idea of the different kind of paradigm we work out of, we feel it's important to go to communities and understand from them what their problems are. I think one of the reasons why we're doing this project is to get nonprofits to understand that it's not been successful to come in communities and decide beforehand what it is you think they need. It's more important to hear from the community and let them tell you what they need, and then work in collaboration with those communities to find the solution.
Thank you. We also understood that it was important not just to seek new solutions to old problems, but to really define the problems and disrupt the current systems and ask different questions. And Gina was the person who represented that voice in our team.
Thank you, Sarah. I'm Gina Nickel. I am the president and CEO of the Foundation for Excellence in Mental Health Care. Right down the road in Wilsonville is our corporate office, but we work around the world and the nation. I was thrilled to be asked to be a part of this group because what we do is we're a group of people that several years ago decided if the system is not working the way that we want it to do, how do we, the people, become system disruptors? Not in a negative sense, but in a powerful together sense. So what we did is we got together and thought about what our mission was, and it's basically to improve mental health outcomes. But we do that by matching the passion of private philanthropy with the world's top researchers and programs. And this is quite a task to take on. And I don't know if it's a honor or a curse to be labeled as a system disruptor, but I think where we are as a people now, we owe it to each other to come together and talk about what works and what doesn't work, not only in our mental health system, but in our whole social and systems fabric of healthcare. And I'm thrilled to be asked to be a part of this, and I will turn it over to you again, but I must say first that everyone that is here, I just welcome you into this conversation because it's going to take all of us to get exactly what we need.
Thank you. You can pass it to Logan.
Yeah, here I am.
Here you are.
So I'm Logan Lynn. I am, in 2014, I joined forces with Trillium to create an advocacy platform around anti-stigma work. I am Chief Impact Officer at the organization as well. And my background is actually not in the healthcare field. I am a consumer of mental health services my whole life. And so I have a very real lived experience around the work that we do. And I'm also a musician and have mainly been in TV. So what I think my specialty is that whole piece around meeting community where they're at. So Keep Oregon Well, I'm the brainchild behind that. We've really been mobilizing community around not just mental health education or anti-stigma work, but around wellness in general. And you know, we're all kind of collectively working to put the head back on the body. I've heard my friend Sheila say that many times. And I would just add that, you know, I agree that in some ways the system is broken or the way it works is broken. But I actually am pretty clear, and I think this whole group is pretty clear, that the system is working exactly how it was designed. And so I think we're collectively committed to not just disrupting that, but also being part of the solution for how to rebuild something that's not a foot of oppression on the communities that we're trying to help.
I'm going to save Wendy for last so she can contextualize the work and talk about her role in sort of framing and holding the foundation for what we built on. So I'll introduce myself. I'm Sarah Yanesy, and I'm the director of the Andrus Sanctuary Institute in New York. I run a program that really sees its primary responsibilities as education, advocacy, publication, and changing the world through creating opportunities for organizations to use trauma-informed care. So our work is in helping not just clients by creating clinical interventions around trauma treatment, but really changing the systems that we know are so re-traumatizing for the people who are seeking services. And also appreciating the fact that our systems are also really vulnerable to the impact of chronic stress, so much so that many of our organizations tend to demonstrate trauma symptoms and need to be treated with trauma-informed interventions in order to recover and be effective in creating healing for the people that they serve. So my role was to bring the trauma-informed lens and language, and the work that we did together was about creating safety in taking those risks towards the goal of social change. We argued some, we disagreed a lot, we found common ground, and mostly we restored our own sense of hope for each other collectively, and became excited about inviting all of you to be part of that with us. We really saw ourselves as stewards beginning this process and creating doors and windows to invite you into the process. So in a little bit, I'm going to ask some questions for you to think about as we're talking more about this graphic and what it means and what our collective thinking was. We're going to ask you to contribute to it, to ask clarifying questions about it, to tell us what we got wrong, to tell us what resonates, and to help us fill in more gaps. But I'm going to ask Wendy now to introduce herself more in depth so that, and to share a little bit about the foundation on which we started this process.
And if you don't mind, I'm going to go ahead and start talking about the fence and all of this. So yeah, I'm Wendy Ellis. I'm a health services researcher. That's the wonky part of me. Policy wonk as well. But more importantly, I'm a child health advocate, public health advocate. I'm here for the babies, literally. And so my work was really born out of a lot of work that I did originally in Seattle, starting around 2000 when I was working with Child Haven. I don't know if any of you are familiar with the organization, but they offer therapeutic daycare for children who have been exposed to abuse and neglect. And we are talking about extreme abuse and neglect. These children have been court-ordered, so they are the fortunate few that actually go through a therapeutic program that is state-sponsored. Of course, again, this is Medicaid dollars, so there's a huge gap between what the program actually costs and what the state reimburses. So I spent a lot of my time fundraising for work that really is for the public good. Fundraising to make sure that we could take care of the precious few that were coming through our doors. It's not necessarily meeting the real need of the community. And I wanted to begin to understand, well, okay, that's about 186 children in King County that we're able to serve, but that certainly doesn't meet the need. What's happening to those other children? And so I ended up going to Echo Glen, which is a juvenile state prison, which serves children with high psychiatric needs. And as I worked there and began to look through this case files, you would see children that were very much eligible for Child Haven, had their exposures at 2, 3, 4, but they never got captured into the system. They never had that community level of care until they had a cycle to what's SMI, severe mental illness, and then were adjudicated. So basically their first efforts of getting, their first attempts of really getting the mental health care that they needed was in prison. I want you to sit there and think about that for a moment. We are sending children, and it's not just Washington State, it's something that's happening here in Oregon that happens across this country. Children are receiving the wraparound care that they need in prison, not in community. So my research really began to understand what in the world is going on with our systems that we cannot treat our children in community where they're needed. And so that has evolved into understanding these gaps, these silos, and how these silos really do not serve our needs. These silos really represent, and all of us represent a various silo here in this room. So, you know, thinking about mental illness, we go down that silo of treating the mental illness only and not thinking about some of the other determinants. Thinking about the violence and crime that children are exposed to, children and families are exposed to in their communities. Asthma, that has been one of the big initiatives in the healthcare system in recent years, where they go in and they'll do remediation. We're going to do mold remediation, and we're going to make sure that they're doing the home visits so that we can get the care, we make sure the child is getting the nebulizer and the medication. But we're not dealing with the contextual issues. They're in substandard housing. So we're medicating children and sending them right back into substandard conditions that they've always been in. Obesity is another one. We've spent over $10 billion in this country to combat obesity, childhood obesity, and we've barely moved the needle. We've thought about healthy eating and physical activity, but we're not really talking about those social determinants. And what are those social determinants? The culmination of all of those adversities that are associated with poverty. And that runs along the length of all of these. So if you think about our vertical approach that we've been doing all along, all of us here, and it's not blaming anyone, because this is the way the system is designed. Donald Berwick has a famous quote, "The system is designed for the results that you see." And so that's exactly what we've seen. We've seen that we've been making maybe some strides in each of these particular areas, but we're not really changing outcomes. Outcomes are only worsening in our country. And so what we came together as a group and said, enough with this vertical. We need to change our axis. Our axis needs to be this horizontal approach. And we came up with thinking about how do we define the work that we do? How do we position ourselves collectively, all of us in this room, how do we position ourselves to really develop, to demonstrate the value that each and every one of us put into our work, put into our communities, and put into the individuals and the clients that we serve. And so with that, it was defining what is our goal, first off. And up there you see it's fostering equity and resilience. And remember, it's not just about bouncing back. It's about bouncing forward as well. How do we equip people to go beyond where they have started, where they have come to us? We don't want them to just stay. We want them to build and to grow. And so that resilience piece in our communities to eliminate disparities in health and well-being. So what does that mean? How do we define ourselves? Our draft definition around social impact organizations, what we want to do is strengthen the social fabric, catalyze economic development, investments, not just in our work, but in our communities, with the cross-sector partners, with an engaged and empowered community. As you heard Michael say, as you heard John say, we cannot do this by ourselves. We cannot prescribe the solution without bringing the community to the table, without bringing some of those other stakeholders that have, quite frankly, more influence in the community than any of us have, because they're the lived experience. They're living it day to day. We might be experts or think we're experts, but we're not experts in actually living. We're not walking in those shoes. And so we have the people that are walking in those shoes to help to inform the solutions. We're only repeating the problem of the system. So I'm gonna pause here and let others.
Well, I think what we also talked about was the challenge that comes along with not only being siloed in a horizontal fence post, but also the limitations of funding and the competition, artificial competition, that gets fostered between and among our organizations that really keeps us from collaborating effectively and making those horizontal interventions our priority. So coming from all of these different viewpoints, economic, anti-racist, looking at equity, looking at resilience as areas of focus, we came up with some thoughts about what we might need to do. And this point in the conversation, we really want to invite you to think about what other things we might do. So I'm going to ask anyone at the table, do you guys want to comment before we ask our questions about some of the things that we thought about and connected with when we had these conversations, or elements that Wendy and I haven't covered yet?
I feel like you were pretty thorough.
Yeah. Well, thank you. I find that's usually the case for us. So we want you to take a few minutes and just think about the following questions. And Sheila is generously going to come around with the mic so that you can share your ideas, thoughts, and responses. The first thing we want you to think about is, what do you want us to clarify? What have we not shared yet that you're curious about? And just a side note, we may not have an answer yet. We may not have gotten there. What resonates with you? What about what we've described so far feels right? What doesn't? What are you afraid of? What things might this open, what cans of worms might be opened in having this conversation or in making this kind of a change? What did we miss? What things are not on this list that you think are important to be here? What perspectives have we not yet engaged or invited? I want to be clear, I think we all do, that this is not an exclusive or exhaustive list by any means. We're really clear about that, and that's what we're hoping you'll help us with. What policy levers are underutilized? Or which ones can we create in order to help us do this work more effectively? And who's missing from the conversation? When you look around the room, whose voices and ideas and opinions will we capture here? And whose will we have to be more thoughtful about soliciting? So those are our questions to you. And then we know we have a few questions from the audience already that we'll respond to, and we would welcome more questions from you in a little bit. But our hope is that you'll answer ours first.
Is there anyone that has something they'd like to comment, or just one of the answers to the many questions she just posed? Would you mind stating your name and who you represent?
Sure. Susan Stoltenberg with the YWCA of Greater Portland. What is the process that you're going to follow? Or we are going to follow?
We. That's right.
That's perfect. Okay, I'll do it.
Go.
So we have a plan in place, really just that's going to be collaborative as we build it. So there's not we're kind of building it as we fly. I think what I would be most comfortable saying we have committed to is gathering this information from you, feeding it into the work that we've done, kind of redrafting and adding to this work that we've started, bringing you back for what we hope is going to be a symposium where we do more presentations and invite more people and gather more voices, and then really come up with some action steps. But what we're really clear about is that we're going to need multiple steps in this process in order to have the community engagement that we know is critical to its success. Without the right people and enough people being part of any movement, it doesn't go anywhere. So we're also welcoming ideas and thoughts about what that process can look like and how you can help us shape it. But that's the beginning steps. Does that answer?
So one of the things I do want to add is that, we are definitely, and if there's a sign-up sheet, if you weren't on the email list, we want to, as a follow-up, kind of send out some emails to give you an opportunity to think through all the things that we're putting on you today and provide us some feedback and think about who else should be at the table, as Sarah said, but also what is the opportunity, not just that we're blanket inviting people to the table, but what will we want them to do, so we can begin to come up with some concrete asks that will then help to inform a concrete agenda.
Yeah, part B of that is this, are we focusing nationally, internationally, regionally? What's the focus?
So for this group, we really want you to focus on Portland, but recognize that this is part of a national movement. We do have a vision that while we're starting here and using Portland as a model for the social impact organizations, we have this idea that we would like to take this and have a series of national convenings. And that would build off of what we're doing with the BCR work, where we also have an opportunity to do national convenings.
Anyone else? Yes. Don't mind just stating your name and your organization.
Sure. Hi, my name is Sherry Dunn. I'm with Dress for Success Oregon. Hey, I got two question and a suggestion. I guess the first question is specifically what areas will you be working on? Because I understand the concept of well and trauma, based, but concretely which areas, and then that would inform my suggestions as to who should be at the table.
So one of the things is you'll see we have it kind of outlined there is we're really focused on the social determinants, not any one singular condition. And so what we're trying to do is pull together a coalition that helps us collectively address the social determinants that are really, as a group, you're going to determine what is the highest priority or which ones are the highest priorities. Where do we have those resources? Because we want to start from a strengths-based approach. So addressing those identified needs, those social determinants that we can do, and then identifying the gaps. And that's where we get into the policy work that as a group we can do more advocacy with regard to investment, whether that's investment from our group or from a public perspective.
Did that answer your question in a way that, let me add another sort of a lens from my point of view as someone who works with a lot of different organizations in specific sectors and are asking the questions of who else in their sectors can be effective. And again, I think what we're asking you to do is to really break across some of those boundaries, frankly. And what I would be saying to all of us is to think about two different kinds of dimensions. One, we're looking for change agents. We're looking for people who are like yourselves, asking questions around what we're achieving and are there opportunities to do things in a different way. And we're looking for people who are connected to networks of the similarly either because they're in community and they're experiencing these issues, and they have every need and important reason to bring that to the table, or are in a similar position as I sometimes am, to be able to come to the table and work with those in community to ask the questions and to really try to wrestle with the kinds of opportunities that are there. So when we're thinking about the kinds of folks who aren't here, we want you to be thinking in terms of, you know, certainly the viewpoints and the kinds of folks who are in a position or frankly by their experience are of a position to be part of what can be a significant change.
Well, and based on that, I guess my suggestion would be obviously native people, the Latino population here in Oregon, as well as the kind of non-English speaking community, which is a broad group, which could be African, it could be Russian. You know, for dress, we see a very, very diverse population. Our clientele is probably more diverse than a lot of agencies, and so those voices frequently feel left out, I know from my interaction. So that would be my suggestion.
Thank you.
I would just also add that, you know, broadly, it's the whole sector too, right? It's the nonprofit sector. In America, in the United States, there's a nonprofit for every 200 people. And it's not working very well from our estimation, and I'm sure you all share that too. So broadly, you know, outside of community, what sector focus? I think it's across the whole nonprofit sector.
Here in the back.
Hi, Lisa Lent with Multnomah County Department of Human Services. And one thought I had, you know, a lot of those fence post silos come from government. And there are a lot of us, I think, that like to think of us as change agents within government. And it would be great to see a table where you had county, state, federal folks who were being part of the solution to break those barriers for those funding streams and start to see a horizontal view. So that would be one suggestion. And then I think the other is youth. As we look at changing demographics, you see that dramatically at 0 to 6. And often our teenagers have some of our best ideas out there. So how do we engage those voices?
So we'll sign you up.
Great points, thank you.
Down here in front.
Hi, this is Emily Barton from the Boys and Girls Club of Corvallis, and I really appreciate those previous two comments because I was planning to address both your questions and some of the work that we do. I really appreciate the anti-racism approach. It's very different than saying culturally inclusive. So I appreciate that. And I want to say that the systems of oppression have reduced the voice of people who have experienced racism. So in the diverse community that we serve at the Boys and Girls Club of Corvallis, we see youth who their greatest struggle to overcome in their academic career is racism they experience in the school systems. So I would say that not only do we need to listen to the voice of the communities that we plan to serve, but I think we also need to build the voices of the communities that are suffering under these systems of repression. So that is some of the work that we do, and we appreciate having a chance to be a voice in this community. Thank you.
That's exactly why we used the words anti-racist and oppression, because we wanted to make clear that not everybody understands racism. If I went around this room right now and asked everybody what racism is, I bet you I could get about 15 different answers. So it's important to try to clarify what that is so we can start to work on it as a group. So that's one of the reasons why we have that topic. And we've spent a lot of time talking about who's not here. So it's important, that you look around the room and see who's not here. Because this is a pretty elite group, and try to figure out with us then how to get those other people to this table so we can meet their needs. Some of the work that that we do. So oftentimes, we come into communities and we do needs analysis. And it's about time we change that paradigm a little bit and start talking about the power dynamic instead of the needs analysis. And if we can get a hold of the power dynamic that's going on in communities, then we can really make communities more resilient and able to speak for itself.
Good afternoon. My name is Marcella Wilson, and I'm the CEO and founder of Transition to Success. First, let me congratulate you, and I applaud your work. I really appreciate your goal to foster equity and resilience in our communities and to eliminate the disparities in health and well-being, the real focus on health equity. My question is, do you have the designated objectives defined to reach those goals, and if so, what are they? And do you have any analytics, any measurements of how you're going to define success, the barriers, the challenges to this really exponential goal that you've set?
Yes.
So that's squarely Wendy. Okay, yeah, sure. So this is where I get to be the nerd. So yes, we are. That's where I was speaking to earlier. Why we're using the BCR as an organizing platform, because we have developed a data dashboard where all of the teams and all of the communities that are a part of this movement can actually report into it. And so we do have clearly defined objectives around, as you saw in the video, the 4 components of the BCR model. So we're talking about the creation of the shared understanding, which tonight is one of those opportunities to create that shared understanding, create shared dialogue, as well as vision, goals, and agenda. And then, doing the system capacity assessment and how that grows over time, how the network, how the partners contribute to that over time. We also have the piece around the cross-sector partners, so understanding who is represented. It also helps the teams very empirically identify who's not at the table and how that changes over time, as well as the community engagement piece. All of those we have represented into the data dashboard. And more importantly, on top of all of that, is the financial sustainability piece of this. And so this is really one of the things where the policy piece comes into this, because we are asking and collecting information in that dashboard with regard to what are the revenue streams that is required to do this work. And how is that proportional to, state, federal, and private dollars? So when we talk about making a value statement about our work, we're making a real value statement. And it's based on real numbers that we will be tracking over time. So yes, there's definitely not only a framework, but there's also the empirical framework to go with it.
Very nice. Could I ask how long this work is funded for? And do you expect to achieve those outcomes within that time frame?
So BCR itself is funded, this initial piece of it is funded for 3 years. We're in the first 8 months of our first year. And so we already are collecting the data, but this is the reason why it's at George Washington University. So it will live on beyond the life of the grant. So we have a means by which we can collect the data in perpetuity. And one of the models of this is that it is not about us funding the sites. So that's one of the main reasons. So as Logan can tell you, when we first approached Trillium about being a part of this movement, we wanted to make sure that there was a means by which they could incorporate this into their workflow so that when our grant went away, the work continues on the ground. And so we're not necessarily doing something with the teams that they could not do on their own other than providing tools, resources, and support, technical assistance. So we worked very closely together in thinking about this evening. We have the communication support, the policy support, but the work, the design of BCR is really so that when the grant dollars go away, this work will continue.
Thank you. Hi, my name is Maggie Bennington Davis. Hi, Sarah. And the first thing I just want to say is this is fantastic. I'm so glad to be sitting here this afternoon and listening to all of this. So good job, Trillium. I'm just so proud to be a member of this community. Good job. I've also learned that if you shut up long enough, everybody else will say what you're thinking. So I want to just say that the comments already made, it's hard to top those. So I'll limit my. So I'm thinking about your questions, Sarah, and what resonates, what's missing, and so forth. The goal of fostering equity and resilience in our communities, it's tough to beat that. The second half, to eliminate disparities in health and well-being, it seems like we want to be way bolder than that. I mean, we want, all boats to rise. And gosh, just eliminating disparities, having spent the last 4 years on the statewide metrics committee, wrestling with, well, what if we just made everybody equal? Not good, because we're not good enough. I mean, we're killing ourselves. We're killing ourselves with the kind of way we are in community with one another, and the way we're really raising our kids in environments of trauma and violence and so forth. So that was one thing, just a comment, an observation. Also, just looking at the graphic, I'm kind of waiting for the next slide that shows, something uplifting and also, yeah, and also this is Portland, and I kind of like rain, so I'm sort of reacting to, well, rain's not bad, rain's good, and then thinking about the silos, and I with many of you in the room talk about silos a lot and sort of the evilness of silos, but there are also some good things about silos in terms of really there's some incredible expertise in each of these silos. And so you want to be careful. We don't want to deconstruct something that really loses the amazing work that's been done sometimes within those silos. So I'll end with one more comment, and then I'll end with a question. Sorry, I'm taking so much time. I love the little video, and I love seeing Dr. Sandra Bloom up there talking. She's so inspirational and so smart about this stuff. And I think she'd be maybe one of the first to say is that we've got to start with our own darn selves and really look at how we are in relation with each other. So one of my questions is, is built into this some agreements on how we're going to conduct ourselves throughout this whole 3-year, 4-year, whatever lifelong process. What are the ground rules for how we talk to each other, what we assume with each other? Are we going to be safe with each other? How do you build trust if not starting with that? And then the last thing I'll say is, I like the horizontal ACEs and toxic stress, and yeah, let's get horizontal. Is that okay to say? But that's true. But what does that actually look like when you guys constructed this? What does that system actually look like? It sounds good, but what does it actually look like? Sorry.
Wow, that was great, though. Go ahead.
I'll respond to part of it. I can talk about that as a team, we really committed to using the trauma-informed values and guidelines for being in relationship with each other that the sanctuary model promotes. And so that took a little bit of education for those who were not familiar, but it happened fairly quickly. And I think our hope is that that will be a foundational element to the work going forward. And I think we've got to figure out how to help people who are going to be part of this journey with us really understand what that means and what it looks like. So that's a task that we need to incorporate into our plans for work. But I also think that the commitment to moving this needle and pushing this a little bit further helped us within the boundaries of that trauma-informed practice create safety pretty quickly. There was a lot of convergence around creating psychological, emotional, social, and moral safety with each other. So my hope, and I think our expectation, is that there may have to be some training for folks. There may have to be some introductory work done in order to create that container for expectations of how we'll work together, but we do have some structure in place, one that I think you're quite familiar with, Maggie. So I'm probably pretty happy about. So I'll let others, though, answer the second part of your question.
I don't know that I'm going to answer the second part, but to your point about protecting the expertise, I don't think, we've talked about it in a number of ways. Like, are we trying to flatten silos? And I think we landed on connecting, right? We're actually trying to connect the network of experts. What would that, network of nonprofits for every 200 people, what would our outcomes be if we all linked arms and did that work together?
So one of the things that, to really kind of be more concrete on what it would look like, is that we have been working really closely with BCR with helping the teams to explore some ways of sharing data across systems at a local level. So we have a partnership with PCCI, which does a project that has spun out of Parkland Hospital in Dallas, Texas, where they have actually created a platform by which local entities can share data. And so part of our work with the local teams is helping introduce them to that. And in Washington, D.C., the local government is actually looking at purchasing that platform for the express reason so that community organizations can share community-level data. And we've also been working with the Centers for Medicaid Medicare Services, as well as the Office of the National Coordinator, where they actually have had 7 pilot states that have been doing this. So they're creating like community-based client records so that you can share information that amongst community providers. And so when you talk about how do you operationalize this, what does it look like, it would be important for that information flow, creating that pipeline so that we can actually look at the client level, how are we serving people in community. That's getting to the operational level. But when you also talk about how do we work together, part of what we've been doing is bringing community groups together in this kind of forum in all of the cities to really, you all define how you work together. You all define how you create your community in order to set that forth. It's just providing that shared environment, that safe environment, so that we can have that dialogue.
I have a follow-up question, just because I think that it's really important to get right down to the nuts and bolts of what trust means, and that was a great question. And I recognize so many of the people in this room that are fighting for the same dollar. How do you instill trust that if they come to this table, that it's going to be an equitable arrangement for them and they don't end up losing the dollars that they previously had? Anyone?
Sure, absolutely. I think that's one of the reasons why I was brought to the table, and I hope you can speak to it also. I look out over the audience and I see so many people that I've worked with over the last 35 years or so in the mental health field and looking at the social determinants of health. There's a lot of expertise in Oregon, and there's a lot of expertise in the United States. And what we're excited about doing is bringing us all to the table to talk about that very question, not hide for it, provide a safe place where we can say what we're afraid of and what we're hopeful for. And first of all, be kind and really operate within the sanctuary model. And I'm so thankful for Logan Lynn basically pushing us towards this conversation. And as far as the money goes, I mean, that's the elephant in the room, right? How do we do this? We're going to crack that nut together. We have to. Some of us may have to give up something. Some of us may have to join together. But we, the people, can figure out what's best for us. And I really appreciate so many people in this room that have the same goals. Now let's do it together instead of in silos. And that's going to take some work, and we're going to have to roll up our sleeves and need a place to feel safe. And so that's why I think there is going to have to be a lot of teaching and making sure that everybody knows the ground rules.
So there's a difference between being safe and being comfortable. So this is kind of a uncomfortable, safe situation. So one of the things that Sarah left out is in the time that we spent planning and trying to put this together. We struggle too. We're all individuals here, and we all have come from different perspectives. So one of the concepts that we had to come to terms with. So how do we deal with the whiteness around in terms of talking about inclusion and stuff. So that's part of the conversation, that we're going to need to have with community and getting that established so we can be more inclusive. I just said that to say that because we're up here together doesn't mean we haven't struggled with those kinds of things, and that we aren't going to continue to struggle with those as we begin to bring this to community.
Can I add one more thing on this, and I think it will lead in probably to the next question, is there is no budget for this outside of the 3-year grant. Everybody that's up here who we work for thinks this is important enough for us to spend time having this conversation. So that's going to be what it is for a little while. But certainly as the Foundation for Excellence in Mental Health Care, I mean, we have the structure to set up a fund where we can fundraise for things that we might think that are important for this piece. So we've thought about the financial structure, we have it in place. It's kind of what comes first, the chicken or the egg, and I believe that that will come as we have those conversations.
I'm Jan Kennedy from Murdoch Charitable Trust, speaking of funding. And I know very little about mental health except that Murdoch does support a great deal of mental health across 5 states. The thing that I really, this is a wonderful thing, a wonderful conversation. What I've wondered about in this conversation and for many years is, especially with regard to what I've heard, I've never heard a word so far today that I think is really a key upstream, and that's family. Nobody has mentioned family. And I look at the ACEs, I know the ACEs, I see the little silos on the screen there, and with perhaps, I'm not even sure there's one exception, all those silos are assisted by families in failure. And so I would hope that that becomes a real serious focal point of the conversation, because, and it's certainly a long-term, not a short-term solution, but as we teach families how to not inflict trauma, so there's no need for trauma-informed ACEs or whatever, I think we would probably serve ourselves well to work at the family level and promote health there, because that would take care of a great deal of these issues that are on the screen. The other thing is that I think, and often it does happen, the faith community is overlooked in these conversations. And I think many faith communities are literally the hub of help for many of these issues, and people turn to their own faith communities. So I think those are 2 areas where the discussion should be broadened.
I'm sorry. I'm sorry if it was missed in BCR, in the video, and in my introduction, but this all started with family. And so understanding that at the core of this, if we are going to impact families, we had to do this in a holistic way. And so that's why that was my impetus for really starting with pediatricians and helping health systems think about not just treating the child, but treating the child in the context of its family and the community. So it's at those 3 levels that is very much at the center of this work. And so that I'm sorry if that was missed. And as far as faith-based organizations are concerned, that is certainly one of these sectors that we try to encourage the local networks to include. Again, I provide a platform and some of the technical assistance and what have you, but it's up to each one of the networks to invite, embrace, and bring those definitely that sector in as well.
I think it's always a worthwhile proposition to remind people of the importance of family. So I appreciate the comment from that perspective as well. And I think what is a helpful frame in our thinking is the sanctuary model's way of understanding the impact of trauma that I think you're really speaking to when you're raising this issue about families. Trauma doesn't just impact individuals. It impacts groups of individuals sometimes even more intensely than it does individuals, because groups of people are made up of individual brains that are very vulnerable to trauma. And so when you put those really vulnerable brains together and then expose them to really awful things like family violence, you see symptoms not just throughout each individual, but exacerbated then by the interactions. And so part of the work that we're talking about as this horizontal intervention is not just looking at how do we create treatment opportunities or healing opportunities for individual children or adults who we recognize are impacted by trauma, but also groups of people, including all of us, who are working in a traumatized system and in a traumatizing system. And how is it that the work we're doing every day may inadvertently be making things worse for some of the people that we're trying to serve, who are already injured, who are now being injured again by our systems? To me, that was so much part of the urgency that we kind of agreed on when we put our heads together. The reason that we need to create social impact organizations and push this movement forward is that we are potentially doing more harm than good for some of the people whose lives we're touching. And that's a tragedy we can't afford to participate in anymore.
Hi, my name's Dion Fugere, and I serve on the board for Trillium. And I wonder what amount of time or energy and resources have been spent on identifying communities where there has been success so that we don't have to start at ground zero, and whether that's within the United States or even outside the United States, so we can take lessons learned elsewhere and apply those here so we can launch at a little faster rate.
We should have mic'd you. So that is the beauty of being a part of a national network, because the collaborative, they meet once a month. And so we are building off of some of the lessons learned in each one of the joint communities. So they're the 4 other communities. But also I'm part of another larger national network that's working on ACEs and toxic stress and social determinants. So in total, we're connected to, through the various organizations, about 118 different communities across the country that are doing this work. And so part of my role is harnessing those lessons, and through the Moving Healthcare Upstream work that we do, we actually harness those lessons and share that. And in fact, you guys are going to be sharing some of your trauma-informed work with the DC team, and I've got the DC team learning from the Cincinnati team around teaching physicians on how to screen for social determinants. So it's very much about each one, teach one, reach one, and harvesting. So we're trying our best not to recreate the wheel. There are a lot of good things that are occurring in this country, and I'll do a quick shout out to the ACEs Connection. They are Robert Wood Johnson funded organization that actually does that. They harness a lot of the good work that's happening at the community level. And so they provide also a means by which you can connect to other communities. So there's plenty of information out there, probably more. It's a full-time job just sifting through all of that. But that is certainly at the center of our work, is like, let's build upon what's already working.
Yes, I'm Johnny Dreesner. I'm with Concordia University. Hi, guys. I want to echo a comment about a missing fence post or whatever, and that's the communities of faith and systems of spirituality. I think the research would suggest that within community, those can become major sources of resilience, and including them so that they may walk away in some ways from being sources of trauma within community, and more sources of resilience within community, I think would be critical for this conversation.
Hi, Stephanie Hooper with DePaul Treatment Centers. My question goes back to the funding. The CCOs in Oregon have traditionally been pretty collaborative through the Affordable Care Act implementation, but private insurance it might be good to have private insurance at the table so that they understand and learn this along with us, so that when it comes time to fund those claims, they're with us instead of re-educating or starting over with them.
here again?
I can probably speak loudly enough.
Well,
No, they can't hear you. Oh, sorry. The tape, sorry. And then after, you just give it to her. Okay. In terms of some of the systems or folks that aren't represented here that I think affect the work that we do at the Y quite heavily, would be the Department of Corrections, and also the criminal justice system, including juvenile justice system, and then the courts and judges, from civil all the way through criminal.
Hi, I'm going to ask even a more basic question.
You are.
Oh, Pam Marian Nason from Providence Health and Services. I'm interested in understanding who the population is. Now, there's a grant that was written around a constraint of a population, and I'm still trying to wrap my head. I can't quite figure out, is it place-based? Is it a neighborhood? Is it kids with mental illness? Is it Portland metro area? Just help me understand what we're talking about.
Sure. So for each one of the 5 sites, it's up to them to define their population, and that was written into the grant. So it is place-based, and it's definitely a targeted population. But through their work with us, they help to determine which one of their populations, what will be. Some of them are zip code, down to 3 zip codes in Dallas. That's what they're doing. In Cincinnati, they are looking at 2 different neighborhoods that are covered by a particular coalition. I'll let Logan speak specifically to what Trillium has identified as far as a population, specific population, but for I would say the expanded work of this coalition, that's up to you all to decide what is your target population.
But Logan, before the other question I have, obviously the metrics are going to be dependent on, that we'll be reporting on are dependent on which population that we've identified. So that's part of why, back to Marcel's question, I'm interested in that too.
I will speak to the BCR piece. So Portland's role, or Trillium's role in the Building Community Resilience, Moving Healthcare Upstream movement, it was hard to identify what we wanted to focus on, right? And we're across the state. I wanted to make sure we were focused on the projects at Trillium that are embedded in community in new ways, potentially, than historically we have been. So we focused on Keep Oregon Well, because the public messaging, we're reaching a bunch of different people that way. Our Chrysalis program, which is a trauma support group for girls in high schools across the state, and the 3 to PhD partnership with Concordia, Portland Public Schools, and Trillium Family Services. We also are working with Boys and Girls Club of Corvallis, and we're thinking about adding that in. I believe that has been decided. So really, it's the populations that are being served by way of those programs specific to building community resilience. But we haven't identified, this social impact group. The reason why we're here today is to think about that question, really. It's, I think it will depend on where we land with all of you. We're using this through the BCR framing because we get to tie into these national connections and the data dashboard, all this stuff. But really, the social impact transformative work we're doing, I don't know that we've identified an audience other than everyone being served by the nonprofit sector, right? And so we really need to drill that down.
I just want to add to that, so that what he was describing, to really get specific with regard to the metrics, because it will change for program to program. So each one of those programs individually report into the dashboard. So they will report their own metrics in there. So we can also, the beauty of that is that each one of those organizations now have a means by which to collect all of their data, to see what's happening in their individual program, but then also through the network, your local network, you're able to see how all of the partners are collectively serving your population.
I guess I would just add, again, the implications of not necessarily constraining ourselves by any specific population, at least from where we sit right now, means that everyone could be. And that's scary. That's get your heads wrapped around complete system change. Yeah. But that's how far we could go. And I think when we looked at each other, when we first got together, we realized that at that point, you're starting to make significant impacts on every level of social structure, individual, family, neighborhood, and on. And I think we get really excited about not deciding, but inviting. And then again, I'll go back to why we are so excited to have you here, and for those that are watching this, to really recognize that this is an opportunity to take the next set of baby steps with us to begin to answer, at least initially, what initial populations where there are opportunities and will to make some of the beginning steps happen. And again, that's what it's really going to come down to, and is will.
One of our initial conflicts that we had as a group was the word revolution, right? It's like, really, that's what we're talking about. We're talking about a total revolution of an entire sector. And so how do you start to do that? Right, and so we're here with you. We started together. We're expanding that, but I think, amidst the conflict around that word, we really are proposing that. That's the bottom line.
My name is Linda Nilsson. I'm with Project Access Now, and everything everybody said about the excitement, I actually feel like I've walked in on one of my own fantasies right now. It totally get out. Yeah. And I say that because actually Trillium is a part of a network of 25 agencies that is currently working on the implementation coordinating effort around this. And I think that, there are all these different spectrums that we all fall on in terms of, do you like to talk policy and think about and analyze, or do you like to do things? And, the truth is we need folks all along that spectrum. And so for me, this is great. I mean, it's nothing new. And the question is always how, how do we do that? And so I don't want to take a lot of time talking about the model we're implementing. I think that it is very well connected with this. And I think we've done a lot of the work that you think needs to get done actually might be started. So I think there's an opportunity to really build on that. And I did want to say that from an implementation or operational perspective, the family piece, the family-centered piece is what's so important, because as we work with families, they do need all these different content-specific areas, but they need someone to sit with them in the space that they're in to make sure that they're getting connected. And so we call that navigation, and we have a model around how we're working to make that happen, ideally across sectors. And then the final policy thing is about funding. Just to be very specific, it's about blended funding. Right now, the silos of funding really put a huge barrier on our ability to put families at the center of the work we're doing. So I'm very excited, looking forward to more.
I think I'm most struck by your comment about the implementation piece, and I appreciate it and agree. What we've talked about a little bit as a team is, one, the need to get really clear about the outcomes, the process, create a logic model, think about what metrics we're going to use. And what's really exciting to learn about all of our different groups is that each of us has been using or practicing a framework with all of those elements that we can draw from. So part of what got us to this in only 2 days and brought some consensus was that we had some shared experience and overlap with what it means to do that level of implementation. So I'm actually really excited about that part too, the how and the when, mostly the when, and the who. So yes, exactly.
Yes,
yeah.
don't reinvent.
Great.
I just want to follow up on your comment about the funding and policy piece of this. And so this is where our work in Washington, D.C. is really important, because we are pulling those policy lessons from all of the communities to help inform a lot of our work. Daniel, my colleague in the back there, is really working with, because we have access to legislators and working in the appropriations cycle, to be able to have that dialogue, to take those real lessons learned from, we have 5 different states. That's a very powerful statement that we can make. When we've brought in Dr. Chang, we brought him in for some congressional testimony last year. We have opportunities to bring your lessons learned to the lawmakers at the highest level to inform legislation. So the fundraising piece of this, the funding piece of this is paramount. And that is, I will feel as if we have failed in 3 years if we do not have some really strong policy statements with regard to the public funding piece of this. So while we are talking about the how, the nitty-gritty of how to get this work done, I also want us to keep in mind, how are we going to inform policy at all levels?
Good afternoon. I'm Helen Higgins. I'm the CEO for the Boys and Girls Club of Corvallis. So it's great to be here. So what I'd like to do is I'd like to make an offer, and maybe it's a shameless plug, you can decide. But we're getting ready to embark on a project with Trillium, bringing together services that are really geared towards kids in our community that tend to be disadvantaged and struggling with a lot of barriers. And we're actually finding that a comment made earlier, that you don't try to come into a community with what you think they need. You listen to the community and you set it up. So about 3 years ago, we had been dealing with a suicide contagion in Benton County, which is surprising. People are surprised that we have such a suicide situation with teens in our community. And we started talking together with our school district and with Trillium and our health department and health providers, and discussed what can we do to bring resources into the community in a way that really meets what the kids would feel comfortable participating in. So 3 years moving forward, what we're working on is an integrated project where the first floor of this combined 20,000 square foot space will have all of the programs that we bring around helping kids academically, helping them, with job skills training, mentorship, resiliency. And what we'll be doing is integrating mental health providers and medical providers and dental services all in a location where kids and teens already feel safe and comfortable to come. So it's really that model of creating a community hub, and we're doing it. And in fact, thank you, Murdoch Foundation. They were one of our first investors in this project. But I would invite you to use this as a laboratory. So we're doers, because today we're actually addressing these issues and problems and needs that kids have today. And we tend to move at light speed because kids grow up really fast. And we don't have multiple years to think about a problem. We need to what we call launch and learn. So we jump in and we do, and we test and we change and we adapt. And so, again, I just make that offer if you'd like to use us as a working laboratory. If all goes well, we hope to break ground on the structure in April and have the real physical structure to do the work in. But we're doing the work today with all sorts of community partners, including our healthcare providers, helping the healthcare industry understand that we're not just another nonprofit with our hands out asking for money. We're actually a really value-added critical partner to the overall success of health and wellness in our communities. And so, we're a little subversive in our approach, but it's fun.
Hi, Marcella Wilson. I want to get back to the comment about developing this network delivery system amongst organizations who are very well intentioned, but really in competitive relationships with one another for a limited pool of funding. My suggestion is, and what I have found very successful is if you bring those competitors together and you collaborate instead of compete for those grant opportunities. And in my experience, what I have found is when funders see a community, even competitors collaborating, not just in their submission, but in their system design, your ability to attract those grant dollars increases exponentially. And that also builds that trust level within that network delivery system.
I just want to amplify what Marcella just said. For example, I also work at OHSU, and in our email chains, they run grant opportunities, and there was a multi-million-dollar, maybe up to $20 million trauma grant that I saw on one of these email chains, which was looking for exactly what we're talking about here, a comprehensive way at looking at trauma and the social determinants of health and how a community could address that. So it's those kind of opportunities that are available. It's up to us to kind of harness the energy of all of our community partners and families to write supports for getting such a grant, putting our smart heads together and creating one that could be awarded.
What's the URL?
I don't know right now. I'll have to look it up.
Okay. He's going to forward that to you, Logan. All right. Any other questions? Yeah, here in the back. I'm so glad I don't have to go to the gym.
Thank you. Sherry Dunn from Dress for Success. The discussion about the competition for funds is one thing, but what I'm more interested in is the competition among need groups. So, for instance, as we talk about who are we focusing on, I agree really fundamentally that a lot of our trauma-based issues really have to be dealt with in the family structure, whatever it is, be it an individual mom or a mom and dad or whatever, however it's set up. And for us, you know, we use the figure that 70% of those in poverty from the Atlantic in the United States are women and children. So from my perspective, unless you're going to impact the lives of women and their stability, all of the money you put in the effort of children is going to, for a large part, be for naught if their mothers' lives are not stabilized and they don't have a stable place to live. And then, but there's another argument that people could make that for young Black men, there's a crisis and they need assistance. And then in Oregon, we have young white kids who are destroyed by meth and heroin. So you have all these competing need groups on the healthy outcomes. So I'm just curious as to how that shakes out.
I'm no expert on this, but you know, how do you decide who's in the most need when everybody's suffering? I mean, it's hard to pick, and so I think that's where the partnership and the collaboration comes in, right? Like, we all serve a certain population that we know is in deep need, and so if we're joining forces and we're still serving those communities, but we're actually offering trauma-informed care to the community. We're offering you know, a whole bunch of other things because we've actually partnered with other people who are experts in their own communities, in their own field. I think that's how we reach everybody. I mean, there's not a giant net, right? We kind of are the net. We're the safety net that is being invested in currently. So how do we actually take those investments and move things upstream, where instead of really catching people with an awesome net, you know, they're not falling in the first place.
So in Cincinnati, the coalition that is being led by Cincinnati Children's Hospital and Beach Acres is actually called Joining Forces for Children. And they have a number of different organizations that serve different populations. So with that, what they're trying to do is, through their process, is understand when there are separate identified needs. So it may be a mother with depression or a mother who is experiencing homelessness, and we've got 2 children. Well, we've got to take care of that mother if we expect those children to be healthy. So it's identifying those partners that would serve the adult need in order to make sure that the children are also in a stable environment. But it's really thinking about, and you see in the BCR model, that system assessment piece of it. So it's understanding, who are we serving? Not only what are we doing, but who are we serving? So that you have a holistic look at how you're serving your community. Again, it's up to the local network to decide. We don't decide in BCR, we just help you through that assessment process. But if you do have a number of different organizations that are serving across those social determinant needs and those various populations, there's no reason why they should compete against each other. What we're trying to do is figure out a way that we work collaboratively so that we can accelerate and amplify each other's work.
I would say, too, that I don't have an easy answer. Obviously, I don't think one exists at this point, or we wouldn't be here. But I think we have some really important questions to ask. And what you raise makes me ask the questions, who is making those decisions? At the end of the day, when all of those populations that you described are competing, who usually gets the dollars? And what does that say about the decision makers? What does it say about us? What does it say about what we value? And is that the message that we all agree to? And I think if it's not the message, if it's not the decision that we would all agree to, then we really have to have some conversations about redistribution of power regarding the resources. And that's really, I think, where all of us became really passionate in talking about the economics of this system. It's really based on disproportionality, disparity, and backwards and upside down economics. And so that's part of what we have to be addressing before we can really make progress. Otherwise, we're going to continue to perpetuate this system the way that it is. And that means we have to take risks. We as individuals and our organizations and as leaders, we have to be willing to take risks. And I guess I want to take this moment again to plug and thank Trillium for taking this first step and taking that risk. Putting us all together and starting this process is a huge undertaking and represents to me a real departure from business as usual. So thank you for that.
Is there any other questions, comments?
I do want to say one thing, because we're all here trying to crack this nut and take a look at what we can do together. And most of us in the room are professionals, although there are some people in the room with lived experience, which I'm very thankful for. But as you were asking that question and describing the groups that are competing, I could go through in my family, and in each group you mentioned, I have a loved one or a friend or a family member that fits that. And so when you take off the professional hat and you step back and put the personal hat on, it's really hard to say, how you divide the baby or who gets help. That's why we're here. We're at the beginning of this, and we have to come to that together. How are we going to do this? As our society spins out of control, or whatever you want to call it, we need to come together to figure out, because we have children and families crying for help right now, more than ever. So we expect you to be with us at the next step and join together in figuring this all out. Thank you.
Yeah, and Dr. Chang?
Yeah, I want to represent Kim a little bit since he was unable to be here. I think one of the things he wanted to emphasize was how our story may relate to other agencies that we'd like to join us. That Trillium traditionally has been a tertiary care facility, and really in moving healthcare upstream, you want to do some prevention work. And so in our journey as a last resort for many youth getting mental health services, we see the revolving door where people keep coming in and leaving, coming in, and we realize the reason for this revolving door is we may do the cutting edge science within our facility, but we're not addressing the social determinants of health. And Kim always likes to say what we like Trillium's journey to be is to evolve from a nonprofit organization to a community benefit organization. So it's really more about benefiting the community in a big way rather than looking at these individual tertiary care kind of facilities. And I want to address one of the questions about change, and I'll use a discussion I had with Bill Dietz, who Dr. Ellis knows well. And he likes to say change moves at the speed of trust. And then we talked about trust moving at the speed of relationship development moving at the speed of communication, and communication occurring at the speed of commitment to meet or convene. So really what we'd like to say at Trillium is like, we want to be a catalyst to convening, having more communication so we can get up to the change part. And it's, not because Trillium needs to be in charge of everything, it's just that I think we've been so struck in our journey of trying to work with youth and families about how we've been inadequate to meet the needs of many of the youth and family we serve. And I think that would be the message Kim would want to give.
So thank you for coming, Today, this was so interesting for me personally, and I know for your friends and other people who might have wanted to be here, this is going to live on YouTube and will be passed around on all of our social networks. And Logan, I'm quite sure we'll have it up at Trillium Family Services website as well, if you want to find it. Thank you, and drive home safely. Or take Max. I hear it's running again.
Thank you, Sheila.